Not every patient wants a big cut across their upper forehead. So it looks like she got a hairline lowering procedure with a hair transplant. Remember that another way to lower the hairline is with surgical hairline advancement. For that procedure, there's an incision that's made here along the upper forehead, and essentially the skin of the upper forehead is removed and then the scalp is brought down, bringing the hairline down with it. This is another way to bring the hairline down and improve the overall contour of the hairline, and this is done by taking grafts from the back of the scalp using either FUE or FUT technique and bringing them over to this area. Now again, pros and cons of each. In this case, she needs to wait about a year to see her final result, and some patients come back looking for a bit more density to better match the hair that they have behind the hairline itself. And what I find with hair transplants is that it's easier to laterally contour the hairline, especially for women, versus a surgical hairline advancement where you have a little less control over the lateral configuration. But with a surgical hairline advancement, you get a more kind of instantaneous result of where your hairline now is, and you don't have to have that awkward phase of shorter hair growing in. But there truly are pros and cons to each technique, and I always take the time to assess the person's anatomy closely, but also their goals and their tolerance for risk, because not every patient wants a big cut across their upper forehead. So again, pros and cons, risks and benefits of various types of hairline lowering, specifically in women, and very important to consider. And it's important, I think, to go to someone who does both so that they don't give you a biased opinion, but rather can assess your candidacy for both and just help you decide which is best and then execute on that.